Hello everybody, how's it going? How y'all doing? Hope all is well. Excuse the way I'm looking right now, but I did say that I was going to start bringing more content and doing videos more often because I was definitely slacking. So I'm here. Just wanted to come and talk to you all about renewal time. Well, I actually had to renew my nursing license by December 31st. So I did that. Here in Louisiana, they're starting something new. I don't know how they do license renewal in other states, but they started something new this year. Normally, you have to renew every year. So I guess they're doing a trial run to see how it will go. So everyone, I want to say, whose last name begins with A through M, I want to say it was, or something like that, they decided to allow us to renew our license for 2 years instead of just 1 year. So, of course, that means that we had to pay extra. Normally it would be like $100, but since it's 2 years, we had to pay $200. And I guess they're just seeing how it goes, if everyone will hold up to their responsibilities of still doing their CEs annually and maintaining that so that we can continue doing the 2 year renewal instead of having to do it every 1 year. Of course, me being a brand new nurse, I was just licensed in 2017, so I did not have to complete any CEs. So that was a good thing. That was a plus because y'all, I had too much on my plate. When you're a new nurse, you're still adapting to that change, unless you worked in the hospital before. Maybe if you've worked in that setting, then it's not as hard to make that transition. But as you all know, it was a big transition for me, leaving my office job of almost 9.5 years to become a nurse. All of this is brand new to me. I'm not used to having to pay for a license yearly or even biannually. I'm not used to that. So, needless to say, that was a breeze. So, did that. I'm almost at my year mark, y'all. I'm almost at my 1 year mark. So, April 3rd actually will be my 1 year. And I'm trying to decide what areas I may want to specialize in because, as you all know, I started working on a surgical unit, and it was strictly surgical when I started it. It was a 16-bed unit. Everything was almost perfect, y'all. I'm not even going to lie. It was breezy, pretty much, because of the help that I had there and because it was such a small unit. Our nurse to patient ratio was great. Great. But we talked about this moving. I'm not going to keep talking about it over and over again. Y'all know that I moved to a 35-bed unit. We did not have the sufficient amount of staff to cover this 35-bed unit, so it has been very hectic, to say the least. And so, I've just been having some thoughts about where I want to go, what direction I want to move in as far as nursing is concerned. We were a non-monitored unit, and which just means that, we didn't have any cardiac monitoring capabilities. We didn't have any of that. We moved to this new unit, and a few months ago, a few months after we moved to that unit, we were all required to take some EKG classes, and we have since started monitoring patients. So, since we have monitoring capabilities, y'all, it's not just a surgical unit. It is now like a med-surg unit because we do some of everything. And honestly, any and everybody can come to that unit. It's like we're getting some of everybody on that unit. Y'all, I know that everything with me, for me, is a test. I'm just seeing how, you know, I had it kind of easy. Nursing is never easy, but I really had it kind of easy with the support that I had. There, I guess you could say I was getting comfortable on the unit I was on. I couldn't even get comfortable really because I only stayed there about 3 months. So I wasn't even out of orientation that long whenever we moved. So, I'm still a brand new nurse. If you ask me, I'm going to be on April 3rd, I'm still going to be like a brand new nurse. If you ask me, yes, I have learned so much and I have seen different things and all of that, but I'm still feeling like I'm brand new just because of how things went. So my preceptor ended up moving to another unit. And y'all, that really saddened me because I felt like I lost part of my support. And then there's another nurse who, she's a charge nurse. She did a lot of helping, training me as well. I learned a lot from her. And she became the unit supervisor. And so she has not been charging on my shift. I haven't been seeing her. I don't know, if her duties are changing. Well, I'm sure, she has more duties now that she's a supervisor. So I've been seeing her less and less. And it has been somewhat discouraging for me because I'm just like, wow, these were my support system. I really felt comfortable whenever I was working and they were there. And so I'm saying that everything is a test for me because I know that I have plans to do some travel nursing. I do want to move around. I don't want to stay in surgical or med surg nursing. I do want to experience other areas in nursing. There's so many different specialties, and I do want to eventually branch out and do that. However, I do feel like God is preparing me for whenever I do start travel nursing, I can handle whatever kind of load comes my way. You have to sit back and think about the fact that everything happens for a reason. Yes, it has been very overwhelming for me, to say the least. And often I've sat back and wondered, why did this have to happen? Because it has been stressful. It has been very trying. And by our unit being so big, sometimes it seems like there is a lack of support. Staffing is not the best on that unit. And a lot of people who come to that unit complain about it. When we're in the med room pulling our meds for our patients and everything, I'm seeing nurses, new nurses, different nurses sometimes every day. And they're like, is this your unit? And I'm like, yeah, this is my unit. And they're just like, the float nurses come to that unit. And we used to be one of the highly favored units. Everyone used to love coming to our unit when we were on the 16-bed unit. But now that we are on this 35-bed unit and we have monitoring capabilities, so we get some of everything, I don't think people care for our unit too much. It's more stressful. But like I said, I knew what I was getting myself into when I decided to become a nurse. I knew it wouldn't be easy. I knew that there would be some challenges for me. And I'm just hoping and praying that I can get through and make it to a year, y'all. I really just want to be able to say I did that. I lasted a year. And I don't know what God has planned for me in the future. However, I do know that there are some opportunities I would like to explore. I don't plan on being a med-surg nurse. I know that everyone says you have to start somewhere. Well, that is true. And I understand that. And I understand that everybody has to pay their dues. You cannot get the perfect shift. You cannot get scheduling the way you want it. You just have to take your lick. You're paying your dues, getting your experience. Eventually, you'll be able to set things up to your liking. But for right now, I'm just hanging on in there, y'all, and just praying that everything works out. That's it, and that's all. I just want to let y'all know that if wherever you're at in life right now, if you're feeling some discouragement, if you're feeling let down by your current situation, just know that trouble don't last always. It gets better. You don't have to stay in the state that you're in. And eventually, you're going to become a better person because of that. It's growth. That's what it is. And so I'm just trying to embrace it and accept it for what it is, because I know that I'll be stronger and better in the long run. Just thought I'd drop some encouragement to y'all. Let y'all know what I'm dealing with right now. And that, yes, I do get discouraged from time to time. But y'all know, as I always say, I'm going to keep on keeping on, okay? Are you yet holding on? Well, keep on keeping on then, baby. Till next time, y'all. Take care.